And what we do here is what? What is constipation? What is constipation management? What are the procedures? Why we will do it? And how we will do. Okay, so first, what is constipation? Anybody knows what is constipation?
Yes, ma'am.
Okay, you stand, whoever knows it.
Constipation occurs when the bowel movement is less frequent, and when the stool is hard.
Okay. Who else has a good answer? Okay.
Constipation is the passage of a hard, dry stool.
Passage. Okay. What else?
It's the formation of a hard stool.
Okay. It is the formation of a hard impacted stool. Impacted means it is so hard that it could not come out. Okay? What is constipation management? We are talking about constipation. And now what is constipation management? How do we manage our patient with constipation? Constipation management. You have constipation, right? You have constipation. What is constipation? It's the formation of hard or impacted stool. So constipation management means the managing constipation by eliminating bowel or impacted stool, okay, cleansing of the bowel, and providing patient good condition. Providing patient good condition and comfortable condition also. Okay, so because once the impacted bowel is out, so the patient will be more comfortable. So we have 4 procedures that goes with the constipation management. Okay, 1 is giving of fleet enema. Okay, 2, we have the rectal washout or bowel irrigation. Number 3 is the Soapside enema or the Soapside Solution. And the last one is manual evacuation or manual rectal evacuation. So we have 4 procedures to do to manage our constipation. So what do we need? Number 1, for the fleet enema, we will be using the commercial or commercialized fleet enema, which comes in like this. This is the fleet enema. So it comes in 100, okay, and there is already lubricant on the tube. So we don't need a lubricating jelly here. So for fleet enema, what we need? Fleet enema, we need gloves, gauze, and kidney basic. Whenever you come to the patient, when you do this procedure, bring this. Okay, second, we have the rectal washout or bowel irrigation. So what we need here is the rubber rectal tube. Rubber rectal tube, actually it's colored red-orange, rubber. Okay, this is not the rubber one. We are just assuming. So rubber rectal tube, appropriate size means to say, for the babies, it will be around 6, 8. Then for pediatrics, it's about 10, 8, 10, 12. And moreover, for the adult, the bigger the size, the bigger for the adult. Okay, so we have a lubricating gel. We have syringe, a septo-syringe. We will be having gauze, gloves, plaster, and saline solution. Okay? So, the next one we have Soapside enema or Soapside solution. So, we will be having Soapside. Either that Soapside solution will be in a container, prepared, ready-made, or it will be in a sachet or packet. That one, there is instruction, so you need to follow the instruction. If 1 sachet, 1 liter, so you have to prepare it. But if you have the prepared one, it's just like this. Okay? So we will be using a connecting tube with that. We will be using also the same way, appropriate size of the rectal tube, gloves, lubricating gel or lubricating jelly, gauze, plaster, and 2 kidney basins. 2 kidney basins and, Soapside solution. Okay, for the last one, we will be having manual rectal evacuation. What we need to prepare, only gloves, lubricating gel, gauze, and a kidney basin. Only this. Okay. So before doing our procedure, so we have the universal protocol. So what are the universal protocol? Hand washing, hand hygiene, or hand washing, or hand sanitizing. What else? Cups.
Collect, arrange, prepare, and sanitize.
Next.
Check the equipment if it's working.
Okay, check your medical equipment if you have, if it is working or functioning well. Okay, introduce yourself and explain briefly what you will do.
Identification.
Identify the patient by what?
By complete name.
Name and date.
If conscious. If unconscious, okay, so your ID band or the family can provide you Emirates ID or passport. What else? Safety of the patient by closing the wheel, lock the wheel of the bed, side rail on the other side up, and in your side it is down to the level. What else? Privacy of the patient, if 2 or 3 patients together. So just draw the curtain, or if alone, you have to close the door. Okay, so now we will do our procedure. The first appropriate PPE. The first procedure that we will do is the fleet enema, giving fleet enema. So as we said, we need fleet enema, kidney basin, gauze, and gloves. Okay, so this is the only thing that we need now. So before anything else, we will position our patient. So what should be the position of our patient?
Left lateral position.
Left lateral position. So in putting the patient on the left lateral position, Same way, scoop the shoulder,
Bend over the knee.
scoop the knee, turn the patient to the left.
Straight back.
Okay. So, back is aligned, straight. One leg down, straight leg, and the other leg is bended over the knee. So, when the patient is already in this position, get your glove. Glove is just disposable. It is not sterile. So, just you take it from there and do it how you want to wear it. So, napunit na. Teka, sandali. Okay. So, once we already put on the glove, okay, get your enema, take off the cover, no need for the gel. I will assuming only, because it might spill. Hold the patient, pinch the buttocks, insert, leave it for a while. So it depends. If for the babies, maybe 10, 15 only, but for the adult, it should be 100 full. So, squeeze the content, leave it for a while. So, once it is done, remove to receptacle, get a gauze, in, circular, out, receptacle, another gauze, in, circular, out, receptacle until clean and dry. So, what we do next is, okay, either you take off your glove or do this one first. Throw this all to, where to throw?
Medical waste.
Medical waste. So remove everything and throw it all together. Ay, why did I remove? Okay? So throw this to the medical waste. Hand hygiene. Go back to the patient. Same way. Scoop, return to the same position. So put on the andi, the pampers, and the blanket and document. 1, 2. We will do the rectal washout or gastric bowel irrigation. Anong gloves yan? Kagaya din ng white? Okay, so the same way for the second one, same way, before you put on the glove, you have to place the patient in a left lateral. Why left lateral?
Because the position of the small intestine is connected to the rectum.
Okay, so because of the position of the small intestine is connected or directly to the rectum. So once the patient is on the left position, so put on your glove. Okay, so as we prepared our things, we will be having, what do we have for the rectal washout? 2 kidney basin. Okay, rubber rectal tube.
Lubricant gel, gloves, saline,
gauze and plaster. Okay? So if you come to the patient, you must come in a tray, with a tray, not on the bed, but on the bedside or on the Mayo table. So we are going to start to insert our tube. So in inserting rectal tube, so just squeeze little of your lubricating jelly. Get your tube, get your rectal rubber tube. You have to fold it this way. Leave at least 4 to 6 inches. And coat it. Only 4 to 6 inches. You do not put the whole thing. Okay? So, hold, pinch, insert. Once it is inserted, so put the other end of the tube in the receptacle. Get a small plaster. So keep in place. Okay, on the tie. So, assuming it is there. Pour out. If doctor said 1 liter, should be 1 liter here. Aspirate 50 because the aseptocyrins is only 50. Insert, connect, push 50, aspirate 50. Okay? You have to pinch it, otherwise it will leak. So, whenever you are not using, you just put it directly to the receptacle. So, dispose to receptacle. Another 50, we are cleansing. Cleaning the bowel. Flushing or irrigating. 50, same way, insert, connect, push, aspirate. Whatever amount you push in, aspirate it to receptacle, and the same way till we complete the normal saline. Okay, so once we are done, keep it here, remove the rectal rubber tube, receptacle, get your gauze, same thing, in, circular, out, receptacle, in, circular, out, receptacle. If this one has poo-poo, you have to throw it to the toilet bowl. Okay? So if there is no poo-poo, it's fine, but still water is there. Okay? So it's out now. Clean. So we will just throw this all together. Take off your gloves. Okay? And throw everything. Go back to the patient. So same thing. Scoop the shoulder. I did not wash my hands. Okay? Wash your hands, go back to the patient, keep the patient on these pampers or whatever, cover the patient, and document. Okay? You document everything. How much, what came out from the aspiration, is the patient comfortable, was there any bleeding, or anything, you have to write everything. Okay? So this is the second one. The third one we will do is the Soapside Solution. So, Soapside Solution, what we need is our soapside. As I said previously, we need to, if there is that soapside sachet, so you have to dissolve it or mix it according to the manufacturers. But if they will give you the ready-made, it will be like this. So we need the Soapside Solution with the connecting tube. So same thing, what we will do,
Left
scoop to the left. Patient is already in the position. Get your lubricating gel. Coat it. Insert. So keep it. So put a plaster here. You get a small piece of gauze and you put it under the tube so that when you connect this tube, it will not leak or it will not make a mess here. So regulate, put it on. So if the doctor's order is 1 liter, we need to complete all of this. So if it is baby, so depending how much the doctor will be ordering. Okay, so put it on. So leave it for a while. Once it is done, you do not make it empty as in empty. Okay, close it. Put it down. Disconnect it with the help of your gauze. Disconnect. So both sides. You just don't leave it like, it's going to mess. Okay? Take out the tube to the receptacle. Same way. In, circular, out. Same. In, circular, out till it is clean and dry. And throw all of this. Hand hygiene. Go back to the patient and okay, so put on the undies, the blanket and everything and document. Last one. Last one, we will be needing only gauze. So I don't want to use the plaster, it's sticking. So what we need is gauze, lubricating gel, and the gloves. And kidney basin. So same way, so put the patient back to the position, left lateral. Get a gauze. Squeeze some of the lubricant with the use of your 2 fingers. Put on the glove, 2 fingers. For the babies like this, use your pinky finger. Okay? Only one. For the adult, you can use these 2. Okay? So, dip or coat it, your 2 fingers, coat with the lubricant to the left. Okay? Insert. Remove. Take it out. Whatever you can remove, take it out to the receptacle. Do it again. Insert, take it out, and receptacle. So once you felt like the patient is already, there is nothing more inside. So what you need, gauze, clean again, in, circular out, receptacle, in, circular out, till it is clean and dry. Okay? Take off your gloves. So put it all in the receptacle. If there is poo-poo, to the toilet bowl. If there is nothing to the disposable medical waste bin. Okay? Hand hygiene, hand washing. Definitely you hand wash now. Okay? So hand washing, everything. Put back the patient. Okay? So put the andi, the pampers, and your, what is this? Cover the patient with your blanket and document everything. Same thing. What you will document, the date, the time, whatever you have done, whatever you have taken, how much, the amount, okay? So everything to be documented. So this is the constipation management. Any question? It's easy, right?
The last one is complicated.
The last one is easy, just these two fingers.
Oh my God.
Come to the patient and that's why I did not experience with adults.
Only for babies.
Huh? As long as, if you are not in the hospital, you can use the baby oil. But usually in the hospital setting, we have the lubricating gel. Outside, you can use any oil except for the frying oil. Just oil, baby oil, whatever. Even water can be, because it will slide down with the water, right? Okay? So who wants to do it?